What's up, everybody? Welcome back to the Move Better channel. I am Dr. Joe, and this is John, the Professor Penasarada. Today, we're going to be talking about baseball players and softball players and some of the limitations that they may have when playing their sport and shoulder pain. Now, with shoulder pain in the sport of baseball, you were saying that something about they may have just some repetitive motions that may be causing pain. There's a lot of things that could be egging on that pain or causing that pain. Now, one of the things that we do when we work with baseball players is, for one, we don't want to change their motions up so much. That's not our job. Our job is, as a practitioner, as a chiropractor, sports chiropractor, we're just trying to optimize their movement performance. We're trying to increase their efficiency whenever they're playing their sport, whether it's throwing or whether it's hitting. And in our case right now, whenever there's pain, we know that they're not efficient when they're throwing a baseball, when they're throwing a softball or hitting, when they're not efficient enough. So with the shoulder, we want to make sure that we have proper range of motion within the shoulder first. Now, with baseball players, we know that there's a certain amount of adaptation that they've already had. They don't have proper whatever it is based off of their throwing mechanics. Now, we want to first see what their throwing mechanics is. So we ask our parents, we ask our baseball players if we can get a little bit of a view of what they normally would pitch like. And then we want to see what their throw looks like at the moment. So we have them in office and we start to see what their throw looks like. We start to see what their hit looks like. And then we base it off of our exam. We want to make sure that our exam is not so far into changing their mechanics. We want to help their mechanics out. And so let's say it's his right shoulder. We want to check in an active range of motion how he has proper flexion, that shoulder flexion. We want to check to see if he has proper extension. We want to see if he has proper adduction, and we want to see if he has proper abduction. Basic stuff, basic movement patterns for the shoulder. Now we want to couple it. We want to be able to do a forward flexion plus an internal rotation without utilizing too much of that shoulder as it rises up. We want to see if he has that forward flexion and external rotation. We want to see where the shoulder is being limited when he throws. Now, as we know, that range of motion right in here is an important range for baseball players. So if you ever slow down a pitching throw, you'll see that external rotation and you'll see a whipping reaction of that arm with the thoracic spine. So it's not just the shoulder. We want to see how the thoracic spine is moving, and we kind of break it up into motions. Now, we've seen what a global assessment looks like when we see what the pitch looks like and in their normal range without the pain. And then we see what their range of motion is at the moment that they have pain. So we want to compare the two, and then we want to see where the deficiency lies in a local range. So step one, pain-free movement. Step two, the pain of the moment, or the global pain in movement. And then we want to break down the local dysfunctions, which in this case right now, we're trying to see what the shoulder is doing because that's the local area that we're assessing. Then we want to see what their thoracic spine is doing. Go ahead and hold. And we want to see just by this, place your knees together. And normally I'll put like a little block between their knees to see where they're rotating at. And then we want to see what their rotation looks like in a loaded position. Now there's a lot more assessments that we do in office, but this is something that you guys can test just at home. We do more of like the lumbar lock. We want to really see if we can decrease the amount of excessive movement that we can get to when we do local range of motion. So we do a lumbar lock rotation test when they're on the ground. We do and in this case for you guys at home, you guys can do it as a seated range of motion. So you're gonna be sitting up straight, bringing your knees together. And we're just gonna look at John right now, and John's not a pitcher, but we can see where his deficiencies lie, okay? So we're gonna rotate right, rotators right as far as you can go, and notice his chest right around here. So the mid of his chest rotates right around here, and then rotate to the left as far as you can go. And he's pretty even when he's rotating around in this area, but with baseball players, we want full range of motion. So we're gonna just rotate all the way, and notice he can rotate a little bit further when I help him out. And that's something that we want to increase when we're looking at that efficiency pattern with his painful responses of the shoulder. So we check that, and then we check the hips. With our range of motion, we want to see how the hips are internally rotating, externally rotating. And in this case right now, we want to see what the loaded position will look like. And so in this case, we want to see if there's an internal rotation dysfunction or an external rotation dysfunction. We're going to do the hip airplane while he's kind of holding on here, and we want to see if and how he feels when he does his rotation. Go ahead and rotate up. So now he's going to do an external rotation of that hip, and then he's going to do an internal rotation of the hip, and we're going to see where he feels any type of strain, or if we see if there's a deficiency with his body. Now notice how John is doing it right here. If you do this if you do these tests a lot, or these assessments or these screens a lot, you want to see how the ribs are flaring right here. Notice he's kind of pushing his ribs out to get his ribs to help out. We don't want that too much. Just try to stay straight. There you go. And we want to see more of the movement of the hip rather than the excessive movement of the lumbar and thoracic spine. Go ahead and switch sides, and then rotate up, and then rotate right back down. And we want to see where his dysfunction lies. We don't want to see motion, so much motion within the thoracic and the lumbar spine again. And then we want to see if he has that proper control of his hip in an external and internal rotation. Now with the hip, we know that the hip is a dysfunction as well. If we know we have internal external rotation, we also need to know if he has proper flexion and extension. And so this motion, when a pitcher throws, they're utilizing hip internal rotation and they're flexing their hip. So our upper body is just as important, or our upper body is important in going down. And so we need to know if our hip has the ability to properly flex without having our upper body load the joint. So utilizing hip flexion is just as important as us going down into hip flexion, if that makes sense to you guys. So in this case, we're just going to check. Let's have you face this way, John, first. And we're going to go into forward flexion. We're going to see how high you can go. And for John, that looks pretty damn good. And so drop that down. And then let's turn and face this way. If you guys can't see it, just start with this leg. We want to see if he has proper hip flexion. Notice his body doesn't lean backwards. He's not utilizing excessive muscles to do the work, and he's using his hip flexors to actually utilize the leg in lifting up. All right, and so that's the pattern that we want to check. We want to check the local range of motion. We want to get him on the table. We want to see if he has proper hip flexion, hip extension. We want to see if the knee bends the right way. We want to check all of the joints. We go by a joint process here. We want to see how the foot is stabilizing. We want to see how the ankle is mobilizing. We want to see how the knee is stabilizing, the hip is mobilizing, and we go in an alternating process all the way up the spine. So, case in point for today, for you guys to check if you guys have kids that you guys are worried about, or if you guys have some baseball players or softball players that you guys are thinking are not as efficient as they need to be, come get checked by us over here. I'm more than happy to see and do a quick screening on them, as well as a range of motion assessment on them. And then we're going to see where the deficiency is broken for their pitching, throwing, or hitting. Finally, when we're trying to work with shoulder pain, again, this all goes back to shoulder pain in their efficiency. Once we see that where the body is deficient in or restricted in, we want to make changes to the shoulder, right? So we work the chain of what's dysfunctional, then finally we fix the shoulder, okay? And so in his case, if we had an external rotation problem, we want to work external rotation in pain-free movement to allow to decrease the pain when they're throwing. If we find that the patient has a problem with internal rotation, we want to add into internal rotation within pain-free movements. So we have to train the range of motion accordingly. Thanks for joining us today, guys, on a quick screening and assessment for shoulder pain in baseball players or softball players. Again, if you guys have any questions on anything that we have, comment below. Let us know how we did in your assessment at home. If there's something that you guys are just not getting, or there's a question on anything, comment below. Let us know. You can email us, you can send us a message. whatever it is, we're here to try to help you guys out to the best of our ability through these cameras. So like, subscribe, share, send it to any of your baseball players, softball players that you guys know that may need a little bit of help with their assessment. Thanks for joining us, guys. We'll see you guys on the next video.